Now, Mr Deputy Speaker, I have the great privilege of being in this parliament responsible on the opposition benches, on the opposition side, for Aboriginal and Torres Strait Islander health. And of course, in the context of the budget, we've seen successive cuts to Aboriginal and Torres Strait Islander expenditure, and 130 in the 500 million from the 2014-15 budget onwards, 130 million of which came out of health. Now, this is at a time when we're supposed to be trying to address the gap between Aboriginal and Torres Strait Islander health outcomes and those of the rest of the population. You can't cut your way to good health. You cannot cut your way to good health. And of course, during the former Labor government, when I was the minister responsible for Aboriginal and Torres Strait Islander health, we developed, in partnership with the Aboriginal and Torres Strait Islander community, as a result of consultations around the country, the National Aboriginal and Torres Strait Islander Health Plan, which scored bipartisan support. The incoming Abbott government reaffirmed their bipartisan support and then developed, in partnership again with Aboriginal and Torres Strait Islander people, an implementation strategy for that plan. We are now 4 years on. 4 years on, and that $1 has been spent developed for that implementation strategy. It's a plan for 10 years. We're in the 4th year of the plan and nothing is happening. Now, I think this should be a source of acute embarrassment to the government, because if we are to address the drastic needs of Aboriginal and Torres Strait Islander health, and in particular in the Northern Territory, to address issues to do with chronic disease, obesity, diabetes, kidney failure, rheumatic heart disease, cardiovascular disease and so on, then what we will need to do is make sure that these programs are funded properly. And we need to make sure that there is an ongoing commitment and funding to Aboriginal community-controlled health services, not only in the Northern Territory but right around the country. They, as I continue to say, deliver some of the best examples of comprehensive primary health care in the nation, if not the world. They are innovators, they understand their communities, they understand what needs to be done to address the Aboriginal and Torres Strait Islander health needs of those communities and the Australian nation as a whole through NACCHO, the National Aboriginal and Torres Strait Islander Community Controlled Health Organisation. They have state-based organisations. But I want to commend here, and I ask those who may be listening, if you are not aware of the work of Aboriginal community-controlled health services around this country, try and get to be aware of it, because they do fantastic work for their communities and as a result have an impact on the national health outcomes for all Australians, but particularly for Aboriginal and Torres Strait Islander people.